In 1961, President Kennedy called on all Americans to rise to the challenges of the day. He knew that success depended upon the unity of efforts throughout the federal government and the nation. The Greater Boston Federal Executive Board, one of 28 across the country, fosters communication, coordination, and collaboration with federal, state, and local government agencies. This is your federal government, and I am your host, Diane LeBlanc. Hello, everyone. Today we are featuring the Center for Medicare and Medicaid Services, which is part of the Department of Health and Human Services. And our guest today is Regional Administrator Ray Hurd. Ray, welcome.
Thank you.
Thank you for being here.
Oh, it's my pleasure.
So, the Center for Medicare...
Centers for Medicare and Medicaid Services. Quite a mouthful.
There you go. Sometimes, so sort of the acronym is CMS?
CMS.
Okay, CMS. So let's start by giving folks a brief definition. What is Medicare and what is Medicaid?
Okay. So Medicare is health coverage mostly for beneficiaries over age 65 that have what we call qualified through the Social Security system. But it also provides for ESRD network, end-stage renal disease, and for other individuals that have disabilities.
What is ESRD?
End-stage renal disease.
Okay.
So ESRD, individuals with disabilities, and then those over 65 are all covered by Medicare.
Okay. How about Medicaid?
Medicaid is designed for lower income individuals that can't afford health coverage on their own. And so that's administered mostly through the states, but on the federal side, we oversee the program and we do what's called the federal matching rate so that the states can administer the Medicaid program for their lower income.
Okay, so your entity is part of the Department of Health and Human Services. Give folks a little bit of the history of the organization and how it came to be.
Sure. So the functions for Medicare and Medicaid started in July of 1965 when President Lyndon B. Johnson signed the Social Security amendments at the time. At that time, the Social Security Administration administered the Medicare program in part, and then as time went by, the agency sort of split out. We were the Healthcare Financing Administration, I think, in 1975, and then in 2001 we became the Centers for Medicare and Medicaid Services. So, but it really goes back to 1965. The interesting part of all that is, even though we're a separate organization, the Social Security Administration is still responsible for enrolling people into Medicare. So when you initially enroll, you go through Social Security, not through us.
Oh, I did not know that. That is an interesting point, and you know, we'll come back to that because I think you know, we're going to touch on some of the things that you've talked about. But you're the regional administrator for what geographic area?
I'm the regional administrator for, we call it Regions 1 and 2. Okay. So in Region 1, it's the 6 New England states: Connecticut, Rhode Island, Massachusetts, Vermont, New Hampshire, and Maine. And then in Region 2, I have New York, New Jersey, Puerto Rico, and the Virgin Islands.
Okay. Do you have offices in all of those locations?
Yes, I have an office in Boston, and I also have an office in Manhattan and New York City, where the New York office is located. And
how are you structured? What is a typical office look like?
So there's 10 regional offices in Centers for Medicare and Medicaid Services throughout the country. I can try and name all the cities: Boston, New York City, Atlanta, we got Dallas, Kansas City, Chicago, Seattle, San Francisco, Philadelphia. Did I miss?
You didn't say them.
And then I missed one other one. No, I guess that's all of them.
There you go. All right.
So, but within all of those 10 regions, we have basically we have a consortia structure for the business line. So there's 4 consortium that are located in each of the regions, and they administer the program and make sure that the policies and the standards are applied equally across the country.
Okay, so I was with you until you said consortium structures. What does that look like?
So we have in the regional offices, or what we sometimes call the field offices, we have 4 business lines, and so they're organized into consortia. So we have the Division for Health Plan Operations. We have the Division for Financial Management and Fee-for-Service Operations.
Okay.
Then we have the Division for Quality Improvement and Survey and Certification. And then we have the Division for Medicaid and Children's Health Insurance Program.
Now, in your region and with those consortium, how many employees are you responsible for?
I have about 135 or so in the Boston office and about 160 in the New York office.
And are those 4 different lines of business, if you will, or are the employees pretty evenly distributed amongst them?
No, not necessarily, because the different lines of business, it all depends on what their focus is on. So some of the consortia have a heavier personnel requirement than the others.
Okay, so Medicare, servicing our senior population, a huge program. Let's sort of drill it down a little bit. What does that actually look like here in the New England area? How do you do
Sure.
that program?
So I think it's best to start with a quick explanation of the 4 parts of Medicare,
Okay.
because it really, that's how the business lines are sort of drawn, and it defines how we do business. So the 4 parts of Medicare are called Part A, B, C, and D. Part A is hospital insurance. So that covers individuals that are on Medicare when they have inpatient stays at hospitals or skilled nursing facilities, those types of things. Typically speaking, there's no payment for somebody in Part A. It's just you qualify for it. It's not always the case. There are some people that do have to pay for it, but for the most part, people don't. Part B is medical insurance, and so that covers our Medicare beneficiaries' doctor's visits and some other programs that Part A doesn't cover. In 2014, the monthly premium is $104.90, and that's the same as it was in 2013. There was no increase there. That's typically taken directly out of somebody's Social Security payments. And then Part C is called by another name, Medicare Advantage. Part C is where we contract with private issuers or organizations that manage healthcare products, like a health maintenance organization or a provider organization. And so beneficiaries can purchase the Part C plan that we contract with. And then the final part of Medicare is Part D, which is the prescription drug benefits, because Part A and Part B don't cover prescription drugs. It's a separate program. If you get a Part C plan, it normally covers your prescription benefits, but if you just have traditional Medicare, Part A and B, then it doesn't. You need a Part D plan to pay for your prescriptions.
So for our seniors who are on Medicare, A, B, C, and D.
Yeah, it gets very confusing, I know.
It is confusing. And I know my mom is 87, and when she needs to make decisions, and she gets all this stuff mailed to her, and she looks, but it is confusing. So what does the Affordable Care Act then mean for all of our seniors who are on Medicare?
So the Affordable Care Act doesn't have any direct impact on Medicare beneficiaries. If you hear us talk about the health insurance marketplaces, and CMS is responsible for the health insurance marketplaces under the Affordable Care Act, as well as the Medicare program. But it doesn't impact our Medicare beneficiaries. They don't have to do anything different than they've always done with their Medicare program. What the Affordable Care Act did for our Medicare beneficiaries, though, is strengthen the program. So each year when we talk about closing the donut hole, which is the gap in prescription drug coverage, that came about because of the Affordable Care Act. So there are a lot of pieces in the policy and the legislation that are helping to strengthen the program.
But our seniors don't need to do anything.
They don't need to
because
do
of the
anything any differently than they've always
Okay,
done.
Good. That's good information to share. Now, how about Medicaid and the Medicaid branch of your office? How do they carry out their work? Do they work with providers? What does that look like?
Let me go back to finish off on the Medicare, because we talked about the consortia business lines.
Yep.
So when I talk Part A and B, the traditional Medicare programs, our Division for Financial Management and Fee-for-Service Operations, they're the ones that oversee those programs. And so they work with providers to make sure that providers understand how they can become Medicare providers so they can get paid from us. And then they oversee what I call the Medicare Administrative Contractors. That's the contracting company that we use to actually pay the bills that come into Medicare Part A and B. So the fee-for-service branch oversees them. Now, when we talk C and D, those two parts, our Division for Health Plan Operations oversees those programs. And they work directly with the issuers, and they go through the accounts, and they approve all of the qualified health plans in the Medicare program to make sure that they're getting a safe and a quality product. So those two branches sort of oversee the Medicare program. And then the Division for Quality Improvement and Survey and Certification. The Survey and Certification branch, they go out and they audit and monitor and oversee healthcare facilities to make sure that the facilities are operating within our program, meeting the conditions of participation to be able to treat and receive payment for our Medicare beneficiaries. And they actually certify facilities.
So one of my questions was, as you're doing this work through your 4 lines of business, do you ever have direct contact with the Medicare recipient?
So yes, and I like to sort of compartmentalize it, because we have relationships with, as I said, the providers and the facilities, and so we manage that part of Medicare. And we also have relationships with the health plans themselves, but the beneficiaries is the big part, and we do work directly with beneficiaries. One of my main jobs is outreach and education. So either myself or anyone in my staff is always available to go out and speak at events or to be part of programs to help educate people on the Medicare program. We also oversee what we call the State Health Insurance Assistance Program, or SHIP is what they're commonly called. That's a grant program, but they are counselors dedicated to our Medicare beneficiaries. So anybody that has any Medicare questions can go through Medicare.gov to find the number to their local SHIP, and they can get one-on-one counseling about anything to do with Medicare.
So local SHIPs, where would you, what is it again?
State Health Insurance Assistance Program.
Okay.
It's a grant program nationwide, and the SHIP funds are administered, they're given to the states, but then they use that to train volunteers to help the Medicare beneficiaries.
And where are these individuals likely to be positioned? Are they in communities? Are they at senior centers?
They're in communities. One of the biggest ones in Massachusetts is ABCD right in Boston. So, I mean, we have them all over the place.
Now, is this an in-person activity? Can you call them on the phone and get advice?
Both. You can schedule one-on-one counseling in person, or you can talk to them over the phone.
Okay, all right. So anything else along the Medicare lines?
Oh, I'm sure there's a lot that I missed. I don't want to confuse
okay.
people or drag it too far down. So.
All right, so the Medicaid program.
Right.
Let's talk about that, and what does that look like in terms of the folks that you oversee and the work that they do on a daily basis?
So our Division for Medicaid and the Children's Health Insurance Program, they oversee that. Now, the interesting part of Medicaid is that every state's program is different, because the states establish their own parameters for the services that they're going to be provided, what their payments are going to be, and how they're going to administer that program. And then we on the federal side have overarching guidance, and we provide matching funds to the states to offset some of those costs. So the Division for Medicaid and Children's Health Insurance Program Operations, they have relationships with the state Medicaid departments to help them administer that program and oversee that program. And as the states want to change their program, they have to submit to us what's called a state plan amendment. You might see it referred to as a SPA in the media sometimes. But we review those amendments to make sure that they match all the federal rules, and then either approve or disapprove them with the states. So a lot of that going on right now with the expansion of Medicaid through the Affordable Care Act.
So this population definitely impacted by the Affordable Care Act.
Oh, absolutely.
Now, prior to the Affordable Care Act, how did somebody tend to receive Medicaid? You indicated Medicare, those individuals come through the Social Security Administration. To sort of get on Medicaid, what's that process?
So each state administers their own Medicaid office, so an individual would apply through their state Medicaid agency for that. Now, with the advent of the Affordable Care Act and the health insurance marketplaces, when somebody goes in to do their eligibility for health insurance on healthcare.gov in the federal marketplace, or here in Mass if they go to the connector, the system will determine if they're Medicaid eligible, and it will transfer that right to the Medicaid system.
So for somebody who was receiving Medicaid benefits prior to the magic date for the Affordable Care Act, do they need to do something?
No,
Or
they're still
okay?
enrolled with their Medicaid program, and they just need to stay in contact with their state Medicaid agency.
Okay, interesting. All right. Let's see. Talk about, you indicated you sometimes go out and speak with people, or folks from your office will. Talk a little bit more about the outreach that you're doing right now.
So as the regional administrator, one of my tenets, as I said, is outreach and education, and stakeholder and partnership development. So where we cross so many parts of the healthcare world, I have relationships with advocacy groups throughout the Northeast, with provider groups, with provider associations. For the Medicare side, we do a lot of outreach and education at senior centers, just to sort of talk to people about what's going on. With the implementation of the Affordable Care Act, I've also been out doing a lot of discussions about what this means to people. Now, under the Affordable Care Act, states could have either run their own marketplace, like Massachusetts does with the connector, or allowed the federal government to do it. So here in New England, for both New Hampshire and Maine, the federal government is administering the marketplace, and the other 4 states are all running their own.
So the marketplace, we're hearing that terminology a lot. It's the federal government, and they're running a program, and they're telling you to go to the marketplace. What does the marketplace look like?
So the marketplace is nothing more really than an internet site where you can shop and compare private health insurance products. So the insurance products that are offered on the marketplace have all been vetted here in Massachusetts through the Department of Insurance, on the federal marketplace in Maine through us at CMS, to make sure that they meet the 10 essential health benefits required under the Affordable Care Act, and that they have the right networks in place to be able to provide people the care they need. So we qualify the products, and then they're just being sold online, and that's all the marketplace is. It's just a website where you can compare all the plans and purchase.
And for folks who aren't inclined to sort of do their business on the website, they can go to the marketplace.
So there are.
What are the other opportunities?
So we have what's called certified application counselors, or navigators, in every state, and they are people that are trained to conduct one-on-one counseling. So you can make an appointment with them and go in and talk, or you can call 1-800-318-2596, and that's our customer service line, and talk to a customer service representative and they can enroll you over the phone if you prefer to do it that way, or they can help you find a local counselor to make an appointment and go in and learn about it.
So is it CMS that oversees the marketplace?
Yes.
Okay, so that's your agency now. There were some initial issues with the website, but things are working
Things are
okay
much
now?
better, yes.
Okay.
We addressed those as quickly as we could, and we brought in some experts to fix the bugs. And I think the last report we had out was that about 3 million people have signed up for private health insurance plans.
Okay. So we've talked about Medicare, we've talked about Medicaid, we've talked about the marketplace. What are some of the other programs that CMS is involved in that, folks might not know about?
So sort of looking at what CMS is all about, really changing the healthcare environment, modernizing it, quality, affordable healthcare for all is really the way I like to say it. So we have a lot of programs out there to try and help people's overall health and to help the system. February, being Heart Month, we have the Million Hearts program that we do with the Department of Health and Human Services and Centers for Disease Control and the FDA, a couple other federal agencies. And our ambitious goal is to reduce the number of strokes and heart attacks by 1 million by 2017. So part of that program is we educate people on what we call the ABCs, aspirin control for people with high blood pressure control, cholesterol control, and then the S is sort of smoking cessation. But those are the 4 drivers that really help people reduce their risk for coronary disease.
Aspirin control for people with high blood pressure?
Aspirin for, well, when we look at the medical community, they prescribe aspirin for people that have high cholesterol, high blood pressure problems. So,
Okay.
so one of the ABCs is an aspirin regimen for people.
There you go. All right. And in preparing for our conversation today, I looked at the website and I came across some information on the CMS Innovation Center, which I thought was pretty cool. Talk about that a little bit.
The Innovation Center is one of our primary vehicles for changing the healthcare industry. So it was born out of the Affordable Care Act. And what they do is they test innovative care delivery and payment models to try and reduce the cost of healthcare. So they basically take applications from interested organizations and give them money to implement these systems to help bring down the cost of healthcare and to increase the quality. So you might hear one talked about quite often called accountable care organizations, or ACOs. Across the country, we've got about, I forget what the number is, I think it's just over 5 million Medicare beneficiaries that are being treated in ACOs. We're over 300 accountable care organizations across the country. What the ACOs do is providers and hospitals and specialists will come together and they'll contract with each other to provide overall care for an individual. So instead of our old fee-for-service system where Medicare would pay for each test and each procedure that a person has, under some of these new initiatives, we pay a set fee for a patient. And then the accountable care organizations, they get to keep some of the savings that they get for doing that program. In the first year, it's about $128 million we've saved the Medicare program.
Wow. That's
just through the ACOs. We have other programs that the Innovation Center is overseeing as well. One is the Community-Based Care Transitions Program. We know that about 1 in 5 Medicare beneficiaries is readmitted to the hospital, usually within 30 days upon release. That costs us about $26 billion a year. And so we have this Community-Based Care Transitions Program to try and stop readmissions. Elder Services of Merrimack Valley here in New England is one of the groups that's part of that. And what they do is they counsel beneficiaries as they're being discharged from a hospital to make sure that they have access to their follow-on appointments, that they have somebody checking on them to make sure they're doing their aftercare and they're taking their medications, so that when a person leaves the hospital, they're not home confused and alone and don't know what to do.
Sure. So, I mean, again, you run some major programs, some very complicated programs, and especially in light of the changes with the Affordable Care Act. But I'm curious, how does the agency, or if you want to sort of drill it down, how do you, at the regional level, know if you're being successful?
That's actually a very interesting question. A lot of it is feedback from our Medicare beneficiaries, but we have, through our Quality Improvements Office, they monitor quality programs, and there's measures that we have in place in the different hospitals. And so we've talked a little bit about our website, but we do have a website that's a hospital compare website, so people can go and actually look at the facilities to see how they're doing with our programs, and we monitor the quality that way. That's one way, and the other way is to just look at the cost improvement as we go forward.
You know, a little bit ago you sort of mentioned your organization's role in overseeing rehab facilities, nursing home facilities where your customers are receiving care. If somebody were considering certain locations, perhaps to put a parent or a loved one, would they be able to get information from your organization as to how well the different locations were doing?
We have a compare website that they can go to. Also, facilities are required to post their last inspection, their last survey on site, so you can always go and ask to see the actual survey that was conducted.
Okay. Again, so many really big programs that you're responsible for. What are your biggest challenges?
Oh, so that's sort of it in a nutshell.
Yeah.
There's so many things going on at the Centers for Medicare and Medicaid right now, between the implementation of the Affordable Care Act, strengthening the Medicare program, trying to find ways to reduce the overall cost of health care throughout the country. It's staying aware of all those programs and being able to educate people on those and stay educated myself. Not to mention some of the political fire that's out there over the Affordable Care Act. It's really challenging to be able to present people the facts and stay away from all the rhetoric.
Well, and that's an important point. I mean, in this show, in this series, we try to bring information to our viewers about different federal agencies and sort of stay away from the politics. With regard to the Affordable Care Act, that's hard to do, but it is the law.
Correct.
And people need information to understand what that means to them personally. You know, I'm curious, how long have you been with this organization?
I've only been with CMS since 2011,
Okay.
so not that long. I was, June of 2011, I started as the Deputy Regional Administrator, and then in May of 2012, I became the Regional Administrator.
And prior to that, your background?
Prior to that, I'm a vet. I spent 20 years in the Navy, but then when I retired, I came to work in the federal sector.
Well, thank you for your service as a veteran and for your continued service. You know, if somebody wanted to get additional information on any of the things that we've talked about.
Yes. Well, you can always contact my office directly. I mean, we like I said, one of my primary missions is partnership relations and outreach and education. So 617-565-1188 is the phone number to the Boston Regional Office, and then we have an email that you can always email us and ask for help as well. From a national perspective, if you're a Medicare beneficiary, you can always call 1-800-MEDICARE, and they're going to answer any question you have about the program. Very knowledgeable customer service reps, and they'll be able to point you to local assistance.
Any idea of how long you might be on, you know, hold before your calls get answered?
For the 1-800-MEDICARE line, they typically advertise less than 10-second wait time, especially this time of year. Now, each year there's an annual enrollment period associated with the Medicare program, so their volume picks up a little bit around that time of year. But that runs from October 15th to December 7th every year.
That's a pretty good response time. All right, so what haven't we talked about?
I'm sure there's many things that we haven't talked about.
What should we talk about?
Well, one more thing that I think is important to mention about the Affordable Care Act, and again, this is just, you know, making sure everyone understands the facts. So the individual mandate that says that everybody is required to have health insurance in 2014, or you're going to pay what we call a shared responsibility when you file your taxes. You have until March 31st to sign up for a health plan if you want to avoid paying that penalty.
Okay, so in terms of, again, your geographic area of responsibility, it's actually New England and beyond. Most of our viewers are in Massachusetts. And Massachusetts, we've not really heard an awful lot about there being any sort of a negative impact in connection with the Affordable Care Act, because we had Mass Health. We had a law here in the state that required individuals to have health insurance. So in terms of what your agency is feeling here locally, does it feel different to you in Massachusetts than it does in the other communities that you're responsible for?
For me, so I look at my fellow regional administrators across the country, and being in the Northeast is it's a blessing, really, because we're so far ahead in healthcare and innovation than a lot of the other parts of the country. So, and where Massachusetts since 2006 has had you know, mandatory health insurance, and they've had the program. Yeah, I don't have to spend a lot of time educating folks in Massachusetts on the program itself.
Any idea, and you know, I always hesitate to ask people for numbers, but sort of any sense of whether, you know, nationally or regionally or even for Massachusetts, what percentage of individuals are on either a Medicare or Medicaid benefit?
Oh, I can't give you those numbers off the top of my head. I don't know what the Medicare and Medicaid percentage breakdowns are now. I do know we have just about 50 million Medicare beneficiaries across the country.
Wow.
And then Medicaid program with the expansion, we'll see a lot more people get signed up. I think the last count we had since October 1st when we launched the marketplace was that about 6 million additional people have qualified for Medicaid.
Wow. You talked about some of the agencies that you worked with. You've talked a lot about your partnerships with the state and certainly your work with the providers, but you've talked about some other federal agency, your relationship to the Social Security Administration, your relationship to the Department of Health and Human Services. Any other agencies that you work with on a regular basis to get your job done?
There's quite a few. Right now, the Small Business Administration, because there's a piece of the Affordable Care Act for small business employers. So we work closely with them, educating small business owners about what it means to them. The Health Resources and Services Administration, or HRSA. I don't know if they've been on here or not. They administer the what we call federally qualified health centers, and so they're assisting us with the rollout of the Affordable Care Act, and our missions mirror each other a lot of ways. So I spend a lot of time with HRSA as well. But we have a coordinated working group of all the federal agencies in the area, and we get together once a month to just sort of collaborate with each other and help each other get the message out.
And that's really important. Is that a regionally based group, or?
Yes.
Okay. And is that group mirrored in other parts of the country?
It is. It is. It's mirrored at the national level, too. So there's a federal coordinated working group that was put together to help implement the Affordable Care Act, but it's carried out, and we have one in each of the 10 regions.
Okay. In terms of somebody who might be watching and intrigued by, you know, the Medicare, the Medicaid programs that you administer, somebody looking for employment with your entity, what do you advise them?
Like I said, you can always contact my office, either via the email or the phone, and more than happy to provide materials or education or point people in the right direction where they can get the assistance that they need. As far as federal employment, if you're interested in federal employment, USA Jobs is the place to go, because that's where we hire from.
It is the place to go. It is the place to go. Excellent. Anything else?
No, I thank you for your time. It's been wonderful being able to talk about the many things that CMS does. I'm sure that I could have found some more too.
Well, and again, in this forum, we just sort of scratch the surface, but it does provide viewers with a little bit of information. So that's great.
All right.
That's great. We're good. So I want to thank Regional Administrator Hurd for being with us today and for helping us to better understand the work of the Center for Medicare and Medicaid Services. I thank you for watching, and I hope that you will continue to join us as we feature other federal agencies on your federal government.